Good afternoon, everybody, and thank you so much for joining us for this very important discussion about funders stepping up. As you may recall, a couple of weeks ago, I sent out a challenge to HIV-specific donors to talk about the need for them to ensure that the HIV infrastructure at some form is kept alive through these very difficult times. And so today we're going to be having presentations by three people. First, it's going to be John Barnes from Funders Concerned About AIDS. And John is going to talk to us about two things. Number one, about potential COVID-19 resources for HIV organizations. You'll be able to find it on his webpage. The second thing he's going to do is he's going to talk about a report, an annual report that they do on HIV fundraising and kind of where is the private sector money coming from that will support this important work. We also invited two donors to be with us today. First is Kali Lindsay. Kali is from the Elton John AIDS Foundation, and we'll be talking about the COVID-19 initiative that they've set up for their existing grantees. And the second is Darwin, and Darwin is here to talk about Gilead's COVID-19 initiative to help with helping with community-based organizations. So we're really glad to have everybody here today. Let me kind of walk you through how it will happen. Basically, there'll be a short power presentation from John and from Darwin, and then we will go into questions. We want to spend probably around 30 minutes of the time in presentation, so that will leave 30 minutes for questions. So please feel free to ask questions. Just so you don't understand how to do it, let's do a little technical assistance. If you look at the right-hand side of your screen, there is a thing that says Go to Webinar Control Panel. In that Go to Webinar Control Panel, there is a little triangle next to the word questions. If you could click that triangle so that it points down, then you can put, this is where we will ask you to put your questions and your names. As a kind of technical assistance to see if everybody could do it, what we'd like you to do is put your name, your agency, and where you're from in this line, just so that we can kind of let everybody know a little bit about some of the people that are on, but we won't get to everybody. So Chip, who's online with us today?
So we have Bruce Morrow from GLAAD in New York City.
Yeah.
We have Shelby Deaton from Raven Martin in New York City. Kathy Garner from AIDS Services Coalition in Hattiesburg, Mississippi. Keith Howard from Aspire, Indiana. John Booman from AIDS Foundation Houston. Christina Schmidgall, Detroit Health Department. Amber King from Alabama Regional Medical Services in Birmingham. David Lee from the Charles R. Drew University of Medicine and Science in Los Angeles. Jenny Bradenbaugh from Baltimore County. Sarah from SCAA.
Great.
So we have quite a lot of people joining us today.
Great. Well, thank you all so much for joining us. Just for those of you who are new, this is part of a weekly series that NMAC does during COVID-19 to bring the latest information and resources to the field so that both we can end the isolation, but also, survive. Because that's got to be the most important thing. We have to survive because there's still a lot of work to do. And so I want to thank the donors here who will be helping us survive. Before we introduce and start the program, I want to do a disclaimer. And this is part of NMAC's commitment to transparency. I want you to know that NMAC gets funds from both the Elton John AIDS Foundation as well as Gilead. We are thankful for these contributions, but we also want you to know that the contributions in no way influence the policy or positions that we take as an organization. You should also know that NMAC plans to apply for the relief funds that Gilead will be offering. We will not be applying for the relief funds from the Elton John AIDS Foundation because we are not eligible. However, we encourage everyone who is eligible to apply because we think that this is going to be a very tough road, and we know that it's going to take serious resources to allow our industry to survive. Final thing is, when this webinar is over, you're going to get a evaluation. It's automatic. It just pops up on the screen. We ask you to be as brutally honest as possible. We're just learning this new format, and we want to figure out if this is the way to provide education and training, and if there are better things or better ways for us to be doing things. So please feel free to put anything that you want in the evaluative component and help us to make sure that this is a better training. So I'm going to start by introducing our first speaker, and that's John Barnes. John is with Funders Concerned About AIDS, and is going to be giving us an overview to where organizations are right now and what we should be doing to stay alive during these difficult times. Thank you, John, for joining us.
Sure. Thanks, Paul. Thanks for having me. And thanks to you and NMAC for organizing this. As I share the first screen, I'm going to just say a little bit about who FCAA is for people who may not know. Funders Concerned About AIDS is a membership association comprised of corporate and foundation funders who focus on HIV and AIDS from around the world. And we work with HIV philanthropy to help inform and educate funders about what's happening. We do a report that Paul mentioned that we release annually on the state of HIV philanthropy globally. And with that report, we seek to highlight funding gaps. We seek to analyze where funding is going and who's doing what, so that folks can find collaborators and partners, and also share best practices. But in addition to working with HIV philanthropists, we work in broader philanthropy, largely with our affinity group partner organizations, mostly focused on critical intersections such as LGBT rights, human rights, reproductive justice, aging, health, a whole range of issues. So I put on this slide our website, www.fcaaids.org. But don't worry if you don't get it down. I think the slides are going to be available, and NMAC is going to be sharing all of our contact information. Now, slide is not, there we go. So, sorry, for some reason my slide's not advancing. There we go. So I was asked to talk a little bit about how funders are responding. These are some of the things that we've heard from funders that they're doing to support grantees, that they are sustaining support mostly for populations most affected by HIV and AIDS, which also happen to be populations most affected by COVID. A number of them are providing new emergency funds, and you're going to be hearing about some of those more from the other speakers. Trying to be responsive to the new context of COVID-19. Some are trying to increase investment in policy and advocacy and find new ways of networking and building organizing capacity. That's some of what we've heard from funders. We're curious to hear about what your experience is with funders and what your funders are telling you. Okay, sorry, let's see if I can get my slide to advance. There we go. Okay, so here we've chosen just a few examples to highlight. The Third Wave Fund is focused on vulnerable communities, particularly LGBT communities, and in particular trans communities. The Health Foundation of Greater Indianapolis has been providing support for their grantees to provide remote services. MAC AIDS Fund, now the Viva Glam Fund, has been focused on essential services like food. And AMFAR is focused on research as always, but also adding critical information about COVID to their Ending the Epidemic database. Also, you'll see here that Elton John AIDS Foundation and Gilead are listed, but you're going to hear more from them later. So I'll hold off on that. I also just wanted to let folks know that Funders Concerned About AIDS is just one funders affinity group. We have many, many sister affinity groups focused on different areas of philanthropy. Some of them are identity-based philanthropy groups like Asian Americans, Pacific Islanders in philanthropy, and funders for LGBTQ issues. Others, like FCAA, are topically based, like grant makers concerned about immigrants and refugees. All of these organizations have resources on their website. And one thing that I encourage folks to do is, when you're seeking funding, is to think outside of the HIV silo and think about how your services are affecting broader issues like health access, like racial disparities, which there's been an increased focus on lately, and really expand your opportunities for funding. And of course, there are resources on data to help keep you current on what's happening. AMFAR is an incredible resource, as I already mentioned. Candid is a resource that used to be called the Foundation Center, and it's a great resource for philanthropy information. Also, the report that Paul mentioned is on our website and is a resource for you, and I'll talk about that a little bit more. So FCAA's resource tracking report is released every year, and what we do is we ask funders to send us their grant lists, and we code them. We code them by geography, we code them by population, by intervention. So we have data from 690. Well, we have data from, I think, 200 or 300 funders. We have 693 funders in the appendix. So it's a great resource for you to look at to get ideas about funders that you may not be aware of. It also provides lists of the top 5 or 10 funders for certain issue areas or locations, and the website is there so that you can find it. We are going to be continuing to do our resource tracking, collection, and analysis through COVID-19. It's an important tool to help funders, but it's also a resource for you, so that we hope you'll think about it. I just wanted to highlight that one of the primary things that we've noted over the last 5 or 6 years is the exit of a lot of major donors from HIV, and this makes the field more volatile. Most of the money comes from fewer and fewer funders. 2 of them are on this call today. So again, I encourage you to think about the services that your organization provides beyond just an HIV lens. And with that, I'm going to introduce Kali Lindsay, who's going to talk about Elton John AIDS Foundation and their efforts at this time.
Great, thanks so much, John. And thank you to NMAC and Paul Quata for the great introduction and for hosting these important conversations and always bringing the community together in times of crisis. I wanted to start out by, saying that the Elton John AIDS Foundation stands with the global community in these troubling times in the fight against COVID-19. Many of you all probably know that at the end of 2018, the Elton John AIDS Foundation consolidated and merged its UK foundation with its US foundation. So we're now one foundation, and we're working across the Atlantic to address HIV globally moving forward. And as a global foundation now, once we learned about the COVID-19 crisis, we immediately sent out communication to our partners to hear directly from them how deeply the COVID-19 outbreak is impacting your work on the ground and what you're doing to meet the needs of people that are affected by HIV. Many organizations responded immediately, highlighting a lot of the things that John just talked about, possibly even doing work to meet the needs of people living with HIV without access to critically needed and protective personal protection equipment. And certainly many have had to make a lot of adjustments to provide services either mobilely or virtually. And in some cases, right, we have to find alternative solutions for individuals. So really finding out how we can really rise to the occasion during this crisis. We're also concerned about the significant gains and progress that we've made over the last 10 years in our fight against HIV. And in light of COVID-19, we don't want to lose the important ground that we've made in closing disparities among disproportionately affected groups. And we really, really recognize the importance of your timely responses and heroism. In response to that, EJAF launched the COVID-19 Emergency Support Fund, and it was really launched specifically to help our partners continue to do that heroic work as we go through this crisis. So it was really looking at the intersection between where there are organizations that are already on the ground that are serving the needs of people living with HIV and need resources to be able to continue to do that in light of the COVID-19 outbreak. One of the things that happened immediately after the pandemic started to unfold was there was a joint statement from Leaders of Philanthropy Serving Organization that really called on funders who may have, become more conservative during a time of crisis to actually increase their support to help individuals weather the crisis. And we had already been working on launching our fund during that time, and we're able to very quickly launch our fund after we got that global call to action. The fund will accept applications from EJAF grantees who have received grants from the foundation over the past 3 years. Grants are available for up to $50,000. We're doing this in addition to maintaining our current support for HIV programs in the United States and globally. So the support fund will not come out of existing money. It will be new money that we'll identify to support grantees over the past 3 years. And we'll do this in addition to allowing flexibility to grantees that have current funding to make changes to their budget requirements so they can meet their needs during the crisis. And finally, we recognize that many of us are having to stand up and address challenges that are happening to communities of color as authorities respond to the lack of access to personal protection equipment and the lack of use of it. And we want to make sure that as we're addressing incarceration and other structural challenges that keep our communities from accessing HIV care and treatment and testing, that we're equipped and ready to respond to those developments in the COVID-19 outbreak as well. And finally, I just want to say that we will continue to monitor developments around the COVID-19 pandemic and determine how the foundation will continue to adapt in a post-COVID-19 world. Our commitment to ending the AIDS epidemic globally is unwavering. So you don't have to worry that COVID-19 will disrupt some of the commitments and the programs that we've talked to you about historically in our commitment to fighting AIDS in the United States and abroad. For all of you who are collecting information about how things are adjusting, what the needs might be, stemming from COVID-19, please reach out to us, share that information with us, because we're thinking every day about how to make adjustments to continue to meet the needs of the global epidemic. So thank you for your time, and I'll turn it over to Darwin Thompson with Gilead.
I got it right this time. Can you hear me, Paul? Am I loud enough?
You sound great.
Perfect. Thank you, Kali. Thank you, Paul, for hosting this. I am Darwin Thompson. I'm Associate Director of Corporate Giving within our Public Affairs Department at Gilead, where I've managed our domestic HIV grant making on our global grants team. And so I just want to walk through what Gilead's response to COVID-19 is for our current partners, as well as potential future partners. Before I get into exactly what we're doing at Gilead, I want to talk about our global commitment to COVID-19 from what we're doing as a company. And so Gilead takes a more than medicine approach to addressing the community challenges, not only faced by HIV, but hepatitis C, as well as in other disease states where we provide medications for. And that includes nearly $400 million in cash to nonprofits globally. To specifically address the COVID-19 pandemic, Gilead is doing 4 specific things. First, we have several phase 3 studies that evaluate the safety and efficacy of remdesivir. And I must say that remdesivir is an investigational agent. It's not approved anywhere globally and has not been demonstrated to be safe or effective for any use in relation to COVID-19. We are rapidly and expeditiously looking to see if it's effective, and we hope to have information in the coming months. In addition to that, we have accelerated and expanded our manufacturing to increase drug supply of remdesivir as rapidly as possible, cutting down manufacturing time from 12 months to 6 months. We currently are in the process of donating all of our 1.5 million doses that we have on hand to be used for compassionate use or expanded access, regardless of any future regulatory authorizations. And then finally, we decided to establish a $20 million philanthropic fund to support nonprofit organizations that are immediately impacted by COVID-19. And I'll talk about Gilead Cares in a second. So to all of our current programmatic partners on the call, or if you know an organization that is a current Gilead grantee, just want to talk to you about what we're doing for those organizations who currently receive grants. Similar to the Elton John A Foundation, we sent out a letter maybe 3 weeks ago that really talked about our commitment to our current grantees and how we would continue as a company to make grants to these organizations, and we would continue with our grant commitments to organizations. We understood that there were some sponsorships that were in events that were going to be canceled due to COVID-19, and we reassured grantees that they not only would they be allowed to keep those sponsorship dollars, but they could repurpose those dollars for general operating use where they saw fit as an organization. We also wanted to ensure organizations that they had the ability to reallocate programmatic grant funds to general operating support, again, to reclassify as those organizations saw fit based on their current needs. We also understood that potential projects will be delayed, and so we are on a case-by-case basis providing no-cost extensions, but as well as providing extensions on programmatic and budget reconciliation reports to Gilead. And I want to reconfirm that we are still accepting new partners for grants, and that we have not suspended our grant making despite COVID-19. And so after sending out a letter to our grantees, we internally thought about what we could do both domestically and globally to support our nonprofit partners, because we understand that with our More Than Medicine approach, we need our nonprofit partners more than ever. So we decided to launch the Gilead Cares Emergency Relief Fund, which is a $20 million commitment to organizations both in the U.S. and globally. Organizations, to be eligible for the COVID Relief Fund, you have to be a grantee within the last 2 years, so beginning January 1st, 2018, and you're able to apply for up to $100,000 to support, but not limited to the below activities. General operating support to sustain critical operations, critical staff, the retention of furloughed employees who were potentially on fee-for-service contracts or who were paid under unrestricted revenues or from fundraising benefits. We're allowing organizations to apply for resources to retain those employees. Costs related to implementing remote working arrangements or other social distancing measures. That could be purchasing HIPAA-compliant software, purchasing laptops, cellular devices, any type of technology or software that could be used to do telework or telehealth. So we are allowing organizations to apply for funding so that they can move to more of a remote working arrangement for the near future. But then also just unrecoverable expenses related to canceled events, lost individual donors, lost fee-for-service revenue, lost revenue from billing or from patient visits. So while this list is not exhaustive, I'm happy to answer specific questions. I know Paul and the team will be sharing my email, or you can email if you have a grants manager at Gilead at grants@gilead.com for specific organizational questions. And then finally, while that is our support for our local nonprofit and global nonprofit partners, we also are doing other relief efforts where we work, live, and play. And so Gilead, where we're headquartered in San Mateo, will be providing a $1 million donation to the San Mateo County Strong Fund, as well as where our Kite headquarters is located in Los Angeles. we will be providing a $1 million donation to the Mayor's Fund for Los Angeles. Additionally, for our global efforts, through our employee matching program, Gilead will be providing matching donations to 3 organizations doing global relief work. The first is Direct Relief. The second is going to be the UN Foundation for COVID-19 Solidarity Response Fund, and then the International Medical Corps. So while, we want to stand in solidarity with the community, and we understand these are extremely complicated times, we are here with you, and we're here with the community. And so with that, I will toss it back to Paul. I'm happy to answer questions that you may have, or feel free to email me. But Paul, thank you so much for organizing this.
Thank you, and thank you everybody for being on the call. We have about a half an hour for questions, and how we're going to do questions is in the question box that is in the GoToMeeting panel. You can write your questions. If you could please post your question and your name and your agency so that we know where you're from, it will be very helpful. And then we'll have Chip ask the questions as they come up. But until we get that first question, or Chip, do we have a question yet?
We do.
Okay.
We had a few as folks were presenting, so we can get to those right now. First question is, will EJAF accept applications from an agency that was previously funded, or must they be funded right now? Or is there any other opportunity to fund those entities?
Hi, that's a great question. And for this round of the Emergency Support Fund, we're only able to allow eligibility to individuals that have been funded or organizations that have been funded by EJAF over the course of the last 3 years. And largely that was a decision just so that we can move the resources out in a timely fashion. Of course, the wider the universe, the more applications that you have to get through before you can write your first check or direct deposit. We're in the land of 2020 now. But of course, just to move those resources out, we'll do this first round, and then we plan to put the resource back out again. And if possible, we plan to do a wider universe. So please stay tuned for that and email me if you have other questions.
Great, thank you. Next question, Chip.
Sure, this one's also for Kelly. This is from Ace at NMAC. Thanks so much for your presentation, the work that EJAF does globally. Could you share what you are doing to support incarcerated populations?
Oh, I love that question. And, certainly globally, that's been a particular issue because we've been worried about what's been happening to prisoners, particularly in light of tuberculosis, in addition to COVID-19. Prisoners are not one of EJAF's priority populations. Our priority populations are LGBT, people who inject drugs, people who live with people living with HIV, and adolescents. But we will support projects that are at the intersection of incarceration in any of those priority populations. So where you have transgender women that are facing incarceration, Latino gay men that are facing either detention or incarceration as a result of immigration status, any of those kind of concepts are right within our wheelhouse, and we will definitely entertain those.
Thank you. Next question, please. Chip, are there any more questions, or should I be asking questions too?
Sorry. Christine says we have a Compass Spark grant from the Southern AIDS Coalition. Does that make us a current grantee of Gilead?
Darwin.
Yes, so thank you for that question. That's a really good question. So unfortunately, you have to be directly funded through Gilead corporate grants to be eligible for our Gilead Cares program. However, in conversations with our coordinating centers across multiple of our strategic initiatives, our Compass initiative, our HEP Connect initiative, as well as our initiative for transgender populations, we are making additional resources available to those grant makers to ensure that they are passing down emergency funding to their grantees as well. So I encourage you to reach out to your project officer at your coordinating center, that being the Southern AIDS Coalition, to find out more information on how to apply for emergency funding through the Compass initiative.
Thank you. Next question, Chip.
What particular grants or funding opportunities exist to support advocacy work?
I'm going to flip this over to John from Fund is Concerned About AIDS to talk about funding for advocacy.
Thanks, Paul. Well, again, I would direct people to the resource page on our website. One of the organizations that's funding advocacy is Levi Strauss Foundation, but most of the funders are funding general operating support, which means that you can use it for advocacy or payroll or whatever you want to use it for. Most of the funders don't have restrictions like that.
Great. Next question, Chip.
Question here about when are deadlines to apply?
Good question. So, Kali, do you have a deadline?
Yes, we do. Our deadline is actually coming up pretty quickly. Our deadline is the end of next week for this first round.
And just so can you walk them through what the application process is?
Sure. You can go right online, or you can email covid19@ejaf.org and express your interest in applying, and you will get an application from us immediately, or you could go to ejaf.org and apply. It's a short and simple application. All we're asking you for is just to certify what the emergency need is and what level of resources you're going to use and how you'll be able to report those expenditures. Unfortunately, we're not able to offer just blanket general operating support grants at this time. But as long as you can certify that you're going to be able to use those resources to respond to some emergency need, whether that be to provide services or to address some kind of barrier to accessing services for populations that you're concerned with, you're eligible to apply through the fund as an existing grantee.
Great. Darwin, could you walk us through the Gilead process?
Yes, so Gilead does not have a deadline for applying. Obviously, with this being a need-based fund, we encourage you to apply sooner rather than later, as when funds deplete, there are no longer any funds left. And so all applications should be submitted through our online grants portal located at grants.gilead.com. Unlike our normal grant applications, you would select a charitable donation request, and we have 5 short questions that we're asking, similar to Elton John. How will the funds be used? How has COVID-19 impacted your organization? What's the financial health of your organization? How much do you have in reserves? And then to upload just a high-level budget, either of how the funds will be used or your organizational budget. We are looking to turn around funds within 2 weeks of submission, and we are accepting them on a rolling basis.
Well, to both of you, I want to just say thank you so much. Turning around those grants that quickly is really important right now during these unstable times, and I know that community would greatly appreciate it. Chip, next question.
This is a comment. This is Tyler Spencer from the Grassroots Project. Just a note to say thank you to all for organizing and for continuing to support us on the front lines. The response and flexibility are much appreciated. Question from Jason from GMHC. For EJAF eligibility, does it include organizations that received free program funding managed by AIDS United?
I'm still on mute. That was actually a great question. Thank you for that, Jason. At this time, we're, with Gilead, we're opening the eligibility up to directly funded grantees. I would encourage, those that have had partnerships with EJAF who would be eligible can also apply to do what we call a partnership kind of agreement. So if you had a group of sub-grantees that were supported by an initiative, the principal organization can apply for support through the Emergency Support Fund and make those resources available to sub-grantees.
Great. And thank you, GMHC. Next question.
What, if any, programs are you currently aware of regarding testing during quarantine?
So that's an interesting question. Last week, we had Harold Phillips on for the weekly update with constituents. And Harold has been talking about the challenge of home testing and the need for, we're talking about, and in this particular case, we're talking about home HIV testing, not home COVID-19 testing. And the challenge right now with home HIV testing is the cost per person. And so I know that there has been an outreach from HHS to various companies to look at how we can get the price point down, because home testing is going to become much more critical as we have to socially distance. And so as soon as we hear something back from Harold, we will let you know. Next question.
Yeah, this is from David Miller. It says the COVID-19 pandemic will require remediation of aid service organizations to reduce exposure for PLWHAs. The example they give here is that deep cleaning of clinics and social service organizations will be needed and is not covered under Ryan White. Will any of the funders here cover that?
Let me, before we ask this of these folks, let me also say that I do think we will be able to go back to Ryan White Care Act and re-ask this question. As you may be aware, in the last round of stimulus money for COVID-19, there was a substantial amount of money set aside for the Ryan White Care Act. And I think this would be the exact kind of thing that they should be doing. However, let me ask Kali and Darwin, could agencies apply for money to do sterilization, to do cleaning, so that, anyway?
Yes, the answer is yes. That is one of the eligibility criteria. So you can apply for, budget redirection to support sterilization services, or you could apply through the Emergency Support Fund for resources for sterilization services. Unfortunately, right now, only open to current grantees, but potentially open further later.
Yeah, I think that's the same for us, especially around our COVID-19. It's general operating. So if they see fit to use it for sterilization services, absolutely. And as we bring on new partners, we can talk about use of funds when we do budget negotiations.
And John, are you aware of any other groups that are supporting COVID-19 work within HIV organizations?
Not beyond the ones that are listed on our website, and I think most of them were on the slide that I showed. There are a lot of funders that are supporting COVID more broadly that HIV organizations would also be eligible for, but the HIV specific ones, I think, are the ones that I've already listed.
Chip, can you do me a favor, and can you make sure to put all of the email addresses for the presenters as well as the URL for their websites up on the answer section so that people can email folks directly? And I really want to talk to particularly constituent organizations who are on this phone. This is how you build relationships with donors. You've got two Black gay men who are donors, who are managing funds with millions of dollars. And first, that makes me so happy and so proud. And I think that we've come such a long way. But it only works if you contact them. It only works if you reach out to them. It only works if you make the initiative. And so I strongly encourage you, when the email addresses are posted, to contact them, to build a relationship, because that's how this work gets done. So Chip, next question, please.
Sure. This is from Bruce Morrow at GLAD. For Gilead grantees, how do you go about getting current grant funds reallocated from project to general operating support? Is there a document that has this info?
Yeah, we're being extremely flexible. I encourage you, which will probably be me, to send an email just asking or detailing how you're going to reallocate the funds or how much you're going to reallocate, and then we can approve it via email. So no documents, no change of scope. We'll do everything via email.
Great, thank you. That's the other thing that I guess I want to say to, if there are any donors on this, making this easier during these difficult times is really important. And understanding that, it is not as simple as it used to be. I was given a document that needed 3 signatures, and trying to figure out how to get 3 signatures during this time period was a little daunting. And so thank you for making it easier. Chip, next question.
Sure. Nicolette Sloan with the HIV Law Project and Rainbow Justice Project of Legal Aid Service of Broward County. Do any of you know of a source for, or will you be developing a guide to HIV organizations transitioning to telework due to the impact of COVID-19 in order to protect the health of our staff and clients?
Wow, important question. So let me be very candid with you and say I don't know of anyone who's doing the telework specific for HIV organizations, and I think it asks some very interesting questions. I do know of resources for telework in general, but I don't think that they talk to the specificity that you're talking about. However, let me turn it over to John or Lindsay or Kali or Darwin and say, do you all know any resources?
I know a lot of the clinics have moved to telemedicine, like Whitman Walker and the other FQHC clinics around the country. I know their work is different than social service agencies, but they're the ones that I know have moved quickly to it. I also mentioned earlier that AIDS Foundation of Greater Indianapolis has been supporting their grantees. I'm sorry, the Health Foundation of Greater Indianapolis has been supporting their grantees in moving to remote work. So I can certainly reach out to them and see what learnings they have from that, and I'd be happy to pass that along.
And I should mention that I also think that this is a critical question for HRSA, and I am assuming that within the near future, HRSA will be sending out some guidance to its grantees around how to do that. But I will ask Dr. Shiver for you. Next question.
This is from Kathy Garner. It says, thanks as always to you, Paul, for helping get agencies connected. Katrina was the first time you helped us. I understand that EJAF eligibility is for EJAF direct funded only. Does that include free?
So that was the same question I was asked a little bit earlier. For anybody that is housed under an initiative that was supported by EJAF, the primary or the principal organization is eligible to apply to the emergency support fund. So get in contact with your contact at AIDS United for free, and they can apply to the fund and make those resources available to subgrantees.
Next question, please.
Tristan says that the audio broke up on her end and she didn't get all the comment regarding at-home testing. What was the answer on that?
So the answer was on at-home testing is that right now the cost point is much too high to make it reasonably to apply at the large scale that we need to end the epidemic. And that right now HHS is doing an outreach to those different home testing companies to figure out if there is a way that we can bring that price point down in order to be able to expand that service. Great. Next question, please.
This is from Anselmo Fonseca. Are organizations in Puerto Rico eligible for these support grants?
Sorry?
Absolutely.
Oh, Callie?
Sorry about that, Paul. All organizations that have been grantees of Elton John AIDS Foundation in the last 3 years, anywhere in the United States, anywhere in the globe, including U.S. territories, are eligible.
Yeah, I would say that I'm not sure. I'm not familiar with that organization and if they're eligible under the Gilead Cares, but we understand the impact that COVID is having on Puerto Rico, as well as the impact that the past hurricanes have had on Puerto Rico. So I'll be, happy to have a conversation with you to at least get you in the pipeline to be a future partner. So I would say email me and we can set up a conversation.
Remember, those email addresses are really critical, and they're saying it here on this webinar, and that's how we build this. So go on. Next question, please.
Sure, and everybody's email address and URL are in the chat box, so you can find them there. From David Miller, AIDS organizations providing food pantry services are being hit extremely hard. Is there any national plan to ensure continuum of service delivery involving Department of Agriculture and HHS?
I am unaware of any, but maybe John, you are aware of something?
I'm not aware of any U.S. government program. I know that MAC AIDS Fund or Viva Glam Fund, that's one of the things they're particularly focused on in their emergency relief. But in terms of a larger scale U.S. government response, I don't know.
To Darwin or Kali, do you know of anything? I do not. Sorry about that, David. Let's go to the next question. Chip, are we done with the questions?
We do not have another question at the moment, but we may have
Great.
more come in. But at the moment, we have a break.
Okay, well, thank you all so much for providing all of the questions. This webinar will be posted online. What we'd like you to do is, as soon as it's done, you will get a evaluation. Please make sure to fill out the evaluation, because I know that many of us went from no webinars to 3 webinars a day. And so what we want to do is figure out how to make them most valuable to you. I want to thank all the presenters for their time and for their effort. And more importantly, I want to thank their organizations for their commitment to making sure that the infrastructure stays whole. Please be safe, everybody. We will be announcing next week's topic on Tuesday, and we look forward to seeing you all next week. Thank you and have a good day. Bye-bye.
Thank you.